Dementia, stroke, type 2 diabetes, all conditions that you'd like to avoid naturally. Regardless of what you've tried so far, the real answer might be between your sheets. Sincere Tonsil explains how a new implantable device could restore your overall health, one well-rested night at a time.
We're all taught not to do this. Don't stick your tongue out. But forward tongue placement could make the difference between a constellation of confusing illnesses and the restorative sleep that could preserve or even extend your life.
How's work going? You've been busy?
Very busy. Yeah. It just stays busy.
Jeffrey Tessing and Anvesh Kompelli are more than just fellow doctors at Little Rock's Baptist Health Medical Center.
There he is. Doctor. Hello, doctor.
They're also doctor and patient on a journey to save Tessing's life through better sleep.
I was having, really bad AFib, and it got to the point where I went to the ER twice because my heart was beating so fast that I couldn't function. I felt terrible. Had to go to the ER. I've actually had 2 ablations on my heart because of the issues.
Tessing's heart was suffering because of how often his obstructive sleep apnea was denying it properly oxygenated blood. That happens every time Tessing or 54 million other Americans stop breathing while sleeping. Many years into his troubles, a sleep study during the rigors of residency at UAMS showed he stopped breathing about 45 times an hour. Earlier this year,
his AHI number was 75, which means more than once a minute. He was pausing, choking, gasping, waking himself up.
CPAP machines that help people with those kinds of issues breathe overnight were of no help to Tessing. He'd take it off in his sleep. He was desperate, thinking he'd never know life out of a sleepy haze.
I would not be able to function. I can't go to the park today. Daddy's too tired. I don't feel comfortable driving or getting up. It's just not safe. So that was also kind of a big deal leading up to all of this.
This ended up being this, a little device called Inspire. Remember that thing about tongue placement making all the difference?
So Dr. Tessing's body has his tongue and his palate close off and fall back when he's asleep because there's a lack of muscle tone. And so this pacemaker for his tongue creates that tone for him when he's breathing in.
At home, he activates it with a sensor waved over his chest when it's time to sleep, and an app tracks what's happening. Now that Dr. Tessing is getting the air and sleep he needs at night, he isn't missing a minute with Margot and Jack or missing out on anything else.
What do we do with all this time? You don't have to nap. Let's go do something, So it was just a complete 180. It was a lot to take in at first, but it feels amazing now.
Some would say inspired. Sincere Tonsil, KRK 4 News.
To be a good candidate for Inspire, you have to have a body mass index of less than 40 and have an anatomic reason for the implant, just like Dr. Tessing.
And that's going to do it for us here at KRK 4 News at 5. We'll see you right back here tonight at 6.